Dr. Napoleon Arevalo is our guest speaker for tonight, our first speaker. Is he here now? He has a Master's of Public Health, University of the Philippines. He is CESO 4, and he will be representing in behalf of Dr. Vergere. He'll be talking about return to work. Hello?
Yes, magandang
Hello
gabi sa
po.
inyo. Hello.
Magandang gabi po, Dr. Napoleon. Can you hear us, Dr. Arevalo?
Yes, magandang gabi po sa inyo.
Magandang gabi po. Maraming salamat po at napagnakan niyo po kami. I'll give you the floor now para mapag-usapan po natin ang topic at hand, which is your return to work po.
Yes.
Okay.
Yeah,
Ready
yes,
na po,
please.
Doc.
Yeah. Okay.
Thanks a lot.
Unang-una sa lahat, the Department of Health, or in behalf of Undersecretary Rosario Vergere, we are grateful that we are invited to today's conference, and we thank the Philippine College of Occupational Medicine for this opportunity to share to you our interim guidelines on the return to work, and perhaps later in the presentation we can entertain clarifications from the participants of this meeting. So if I can have the first slide, please. So as we have anticipated the easing out of the enhanced community quarantine and shifting to the general community quarantine, the issuance was made on May 11, 2020. So this is a department memorandum, which is an interim guideline on the return to work, which aims to prevent, control, and reduce infection in the workplace. So the general guidelines include the following. First, the employers in the workplace shall adopt business continuity plans to prevent the spread of COVID-19, and that employers shall develop a work arrangement that will reduce the number of people in the workplace and also reduce the need to travel, including work from home arrangements to those whose tasks can be done at home and among employees at risk. This includes the ones who are included in the high-risk group are the employees beyond 60 years of age or of any age with comorbidities or pre-existing illnesses such as hypertension, diabetes, cancer, or immunocompromised health status, or with high-risk pregnancy. When we speak of the high-risk pregnancy, these are the ones on the gravity 1, the first pregnancy, as well as the 5th pregnancy, because by study we see that there's a high mortality on this age group or on this stage of pregnancy, and that those high-risk pregnancies are also be certified or be issued certification from their attending OB gynecologist that this is a problematic pregnancy. And number 2, that social support that will facilitate compliance must be in place. This include appropriate policies on sick leave and medical insurance coverage to accommodate COVID-19 situation and pay allowance from the employer. In fact, other institutions are even providing accommodations, meal and accommodations to their employees so that they are easily or they can easily report to work. And number 3, apologies for the numbering. Pasensya na po kayo, medyo nagmadali ako dito sa aking PowerPoint. Number 3 would be the workplace facility shall screen returning employees or workers for influenza-like symptoms, like we have temperature checks and proper disinfection of inbound and outbound persons, which shall be strictly implemented. And last, the non-pharmaceutical intervention should be implemented in the workplace, such as infection prevention and control measures, such as hygiene promotion, environmental cleaning, disinfection, physical distancing, health education, and other public health and safety measures indicated in the joint Department of Trade and Industry and Department of Labor and Employment Interim Guidelines on Workplace Prevention and Control of COVID-19. We hope that the participants are aware of this joint department, interim guidelines of DTI and DOLE as also a guide for the return to work. And the guidelines issued by the Department of Health, this guideline that I am sharing to you is in sync or in harmony with the joint interim guideline of the DTI and the DOLE. Next slide, please. For the specific guidelines, these include the engineering and administrative control measures that the employers must ensure that the workspace is properly disinfected, ventilated, and maintained. Number two, the employer shall also provide proper visual reminders for safety policies around the workplace in strategic places to improve compliance and to remind from time to time our workers that we have to strictly adhere to the non-pharmaceutical interventions. And that number three, the employers may also adopt and implement alternative working arrangements for the government, the Civil Service Commission Memorandum Circular number 10, series of 2020, and for the others, the private sector, the Joint Department of Trade and Industry and Department of Labor Employment Interim Guidelines on Workplace Prevention and Control of COVID-19. For letter B, the implementation of other prevention and control measures. First, the office or the workplace should assign a focal person, or pwede yan kung nakikita natin sa ibang offices mismo yung ating mga security guards, conduct daily temperature and symptom monitoring and recording of all staff who report to work so that it would be easier to track if they develop symptoms or they get infected. Number two, we establish referral network for employees who will develop symptoms. So dapat ngayon, ang ating mga establishments, ang ating mga organizations already have their identified health facility to refer their patients or to refer their employees if they develop symptoms. Number three, the employers must enforce infection control procedures such as physical distancing, wearing of masks, the meticulous conduct or performance of hand hygiene. Usually ito yung mga nakakalimutan natin. Hindi tayo masyado sanay na frequent hand washing, lalo na yung sinusunod natin yung proper hand washing na kumakanta pa tayo ng happy birthday, no? And then we really have to rub all the intertriginous areas, the palm and the dorsum of the hand. And the cough etiquette as stipulated in the Administrative Order 2020-0015 on the guidelines on the risk-based public health standards for COVID-19 mitigation. This guideline or this administrative order is or can be accessed in our DOH website. So lahat ng guidelines natin related to COVID, which are already signed and approved, are already can be accessed through our website. Appropriate PPE shall also be worn based on the setting of their work, like face shields and masks for those who render service via face-to-face encounters. So if you can see or observe in the yung mga groceries that have opened or have opened all throughout the lockdown, nakikita natin na yung mga cashiers, yung ating mga bagman doon sa ating cash register ay mga naka-face shield and masks. Number four, employers shall implement activities to promote physical and mental resilience among their employees and workers, and ensure other measures to reduce transmission, contact rate, and risk of infection of COVID-19 as indicated in the joint DTI and DOLE guidelines. If you take a look at this last, promoting physical and mental resilience, importante po na meron tayong mga serbisyo sa ating mga workplaces, like how can our employees and workers access mental health and psychosocial support. This is equally important with the physical health, and that meron tayong hotline, yung Kamusta Ka, Tara Usap Tayo, 09147-899-8727, and the rest. This is a hotline which is manned by the National Center for Mental Health, where we entertain individuals that might be needing or requiring mental health and psychosocial support. Can we have the next slide, please? So for us, continuation for the specific guidelines, letter C, the screening of returning employees and workers. So importante ito, as we have eased out from ECQ to GCQ, we have our employees returning to work, at importante na they are screened for any symptom or sign that would signify that maybe hindi lang COVID, but also other illnesses for that matter. So that returning employees and workers shall be screened for COVID-19 symptoms. Workers who are physically reporting to their place of employment shall be screened to include fever, cough, colds, and other respiratory symptoms, and or relevant history of travel or exposure within the last 14 days. We highly encourage the employees to be truthful of their travel exposure or their travel history, as well as their history of exposure. Ano po itong ang importance ng being transparent with their exposure, possible exposure to a patient or a history of travel? It's because sa ngayon, meron tayong mga asymptomatic or the pre-symptomatic period that sinasabi there is an accumulating evidence that at this point in time, pwede na maka-infect. So, dapat the following exposure should have happened 2 days before or within 14 days from onset of symptoms of a confirmed or probable case. Una, face-to-face contact with a confirmed case within 1 meter and for more than 15 minutes. So, kung merong isang confirmed case like kunyari, kamag-anak sa loob ng bahay, and then nagkataon that unfortunately this kamag-anak has been confirmed of COVID-19 infection, then yung close contact niya, naka-face-to-face niya within 1 meter and nakapag-usap more than 15 minutes, that's a criterion for this patient, for this employee not to report yet to work. Then direct physical contact with a confirmed case, ito naman yung mga empleyado na directly caring for our COVID-19 patients. Ito yung mga sa hospitals, sa clinics, sa outpatient departments, and then direct care for a patient with probable confirmed 19 disease without using the proper or the appropriate personal protective equipment. Those who are symptomatic, those returning employees and workers who are symptomatic with relevant travel history or exposure on the date of work resumption shall not be allowed to physically return to work. And they must immediately consult with their primary care provider. Meron din itong instruction that pag meron kang sintomas, you can notify by phone yung iyong primary care provider para yung mag-a-attend naman sa inyo ay makapaghanda ng kanyang personal protective equipment. And that the use of telemedicine sa ngayon is encouraged, strongly encouraged or highly encouraged for proper care and coordination. So, iniiwasan din natin yung pagpunta doon sa ating mga healthcare provider that we know they are taking care of COVID-19 patient. But we already have a guideline that our health facilities, the hospitals, the clinic, the outpatient clinics should have a non-COVID and COVID pathway. Parang dalawang separate areas where they can do consultation sa COVID patients, and that an area separate which are for non-COVID patients. Returning employees and workers who are symptomatic with relevant history of travel or exposure within the last 14 days prior to the date of work resumption shall present the certificate of quarantine completion. So itong sinasabi nating certificate of quarantine completion, kung sila ay na-admit or na-refer sa isang quarantine facility, the quarantine officer shall issue the certificate of quarantine completion. But if they were quarantined at their homes and monitored by the local health authority within their areas or doon sa residence nila, ang magre-release or mag-i-issue ng certificate of quarantine completion is the local health office, whichever is applicable based on our latest guidelines on the reintegration. So kung na-admit siya sa isang quarantine facility, which we term now as temporary treatment and monitoring facility, then yung ating quarantine officer ang mag-i-issue ng certificate of completion. While kung sa bahay at na-monitor siya ng local health authority, yung local health official ang mag-i-issue ng certificate of quarantine completion. Yung iba naman, like for example, yung nag-positive at na-admit, of course, their attending physician can issue a health certificate that they are already fit to work, meaning to say they are already cleared of the disease. And those who are asymptomatic within the last 14 days prior to the date of work resumption, employees and workers can be cleared to physically return to work. So ito na yung sinasabi natin that walang exposure, hindi naman siya na-quarantine, nasa bahay lang naman siya, and then asymptomatic na siya for the last 14 days and they can be permitted to return to work. Next slide, please. To continue, yung testing of asymptomatic returning employees. Ito yung medyo may challenge sa atin ngayon lahat because some might be, some employer, while testing is an important component of the response against COVID, may limitasyon tayo on their reliability and validity. So syempre, ang Department of Health, ang ating stand siguro, even our Society of Occupational Medicine might or share probably our stand that the golden standard is the RT-PCR, and the rapid diagnostic tests are less reliable, and they should be, before using, they should be validated, or they should be appraised by the Food and Drug Administration, validated, and these are also validated by RITM, so that, or confirmed by RITM, so that we can say that patients has an ongoing infection or probably has been infected and has recovered. So employers who opt to conduct testing may do so in a representative sample. We'll provide you with a a matrix that would guide you on these testings if you opt to do testings of your returning workers. And of course, meron tayong mga priorities sa testing with a limited capacity. So, ang sinasabi natin that yung mga symptomatic na frontliners, sila yung mga priority natin. May subgroupings yan. And then, ang susunod natin, ang last group natin, yung mga asymptomatic health workers that should be tested so that we ascertain that they're still capable of working as frontliners and they are not infected. So, those testing using the RT-PCR, if the returning employee or worker tested positive, of course they will be isolated immediately and referred accordingly for appropriate management, and all contacts shall be isolated and tested accordingly. That is why it is important that the establishments or the offices have designated focal persons to do screening and to navigate our returning workers should there be a need for isolation and referral to our health facilities. If found negative, they can continue working with the usual precautions, the wearing of masks, physical distancing, the alcohol rub, disinfection of your work area, workspace, and that those initially tested negative but develop symptoms, they must be tested. They must be tested accordingly. So, kung naman balik tayo sa itaas, kung mag-positive siya, then they can be isolated immediately and referred accordingly. And also, employers shall report the results to the Department of Health in accordance with the Administrative Order number 2020-0013 na kung saan ito yung ating bagong batas. There is mandatory reporting of notifiable disease, and in this case, COVID-19. Next slide, please. So, testing using FDA-approved rapid antibody tests, sorry for the wrong spelling, if the returning employee or worker is tested IgM negative and IgG negative, meaning to say they're not infected, they have not been infected, or if IgG positive, regardless of IgM results, they may continue to work. Because pag sinabi namang IgG positive, meaning to say the patient has been infected and has gotten well, so they can continue to work. If patients or employees tested IgM positive but IgG negative, this means that probably the patient is having a current infection, no? And di pa nagde-develop IgM pa lang, later pa magde-develop yung IgG. On the first test, if IgM positive but IgG negative, the employee shall be immediately isolated for 14 days, and repeat test on the first 14th day should be done. If results are still IgM positive and IgG negative, the quarantine is extended by 7-day increments and repeat testing. So pag nag-positive siya, so IgM positive but IgG negative on the second, mag-quarantine siya additional 7 days and then another testing. Pag nagkaroon ka ng negative for 2 consecutive retests after the first 14-day period, magko-consider na tayo ng potential false positive dito. And that employee should be referred to an infectious diseases specialist. So, and then, may I have, yeah. And of course, the employers shall submit to this link the results of the rapid antibody test among sample representatives using the format available on this link. And of course, the cost of testing is not covered by PhilHealth and shall be borne by the employer. Next, please. Next, please. So this is the decision matrix for sample representative of asymptomatic employees with relevant history of travel or exposure. So ito yung mag-o-opt ang employer na i-test. So ito na yung kung using RT-PCR as baseline, kung positive, i-isolate kaagad, manage and refer accordingly. Then all close contacts shall be isolated and tested with RT-PCR as well. If negative, then may continue working with the usual precautions. If symptoms develop, test using RT-PCR. Cost of testing for symptomatic returning employees shall be subjected to PhilHealth policies. And all costs will not be covered by PhilHealth and shall be borne by the employer. Next, please. So, ito hindi na ito, medyo technical na ito sa atin lahat, but yung kanina din tong in-explain ko na yung IgG-IgM, so pag positive sa IgG, tapos both negative sa IgM, positive sa IgG, and then negative sa both or positive sa both IgG and IgM, they are not actively infected, ang conclusion, and may continue working with the usual precautions. But ito, yung sinasabi ko kanina na kung IgM positive and IgG negative, we isolate for 14 days, tapos repeat testing after on the day of the 14th quarantine. Pag positive pa rin, extend for 7 days and then repeat testing. Pag persistently positive, IgM positive, then we consider potential false positive. Next, please. Next slide, please. Okay, so I also can share to you this is just draft guidelines on the occupational health and safety in the workplace during the COVID-19 pandemic. This is a guideline which is for signing, but this is complementary and would support the guideline on the return for work interim guideline. May I have the next slide, please? So ang nakapaloob lang po dito sa draft guideline na ito is that one is it's applicable to all workplaces and offices that include service providers like utility and security. And then ang nakalapaloob ditong matingkad is the Occupational Health and Safety Plan, which should be formulated by the Health Safety Committee, at ang mga nakapaloob dapat dito yung health assessment and monitoring of workers, the engineering controls, administrative controls, the PPE requirement and usage, and then mental health and psychosocial support services, capacitation of health workers on COVID-19, the infection and prevention control at the workplaces, reporting and referral of infected workers. I think this is my last slide. Thank you for your kind attention. Maraming salamat po.
Dr. Arevalo, maraming salamat po sa pagpapaunlak po sa amin at sa inyong oras. I thank you so much for your precious time. Everyone, if there have any questions, again, please feel free na ilagay po sa chat box and then ibigay natin kay Dr. Arevalo yung mga questions na yun. Alright, so we're going to go to the next question. Next speaker po. Our next speaker is our current National President of the Philippine College of Occupational Medicine. He's a diplomate of Philippine College of Occupational Medicine and a fellow of the Philippine Society of Medical Specialists. He is one of the co-founder of the Hospital Occupational Health and Safety Congress on 2012. He is currently the Unit Head, Center for Corporate Health and Credentials Committee Chair and Section of Occupational Medicine, Department of Family Medicine at University of Perpetual Health, Dr. Jose G. Tamayo Medical Center. He's also a Medical Officer 3 and Infectious Disease Chairman at Laurel Memorial District Hospital, Tanawan City, Batangas. He's also affiliated with Surtech Electronics Corporation as Clinic Manager and OH Physician, Barracks Imaging Philippines as Lead OH Physician, Century Pacific Food Incorporated, and Bake Masters Incorporated as admin in Occupational Health Services. Without further ado, let us all welcome Dr. Phil Pangilinan. Hello, Dr. Phil. Good evening.
Hello, Dr. Vilus. Can you hear me?
Yes, I can hear you loud and clear. So we
Yes.
go. Opo, maraming salamat sa oras niyo, Doc. Ano? Can you go ahead now with your presentation?
Yeah, thank you. Good evening, everyone. And thank you for having me here. I would just like to give commendations to PCOM QC chapter on your 16th Kapihang OH and your second online edition. And I was tasked to give a lecture for the new normal in occupational health and safety practices and return to work guidelines. Next slide. Our main objective is to emphasize the principles of work resumption during this time of pandemic, the workplace readiness, and I'll be tackling a little bit about workers' rights and duties of employers. Next slide. As an occupational health physician, we are always guided by our Bible, the Occupational Safety and Health Standards, where it specifically states that we are mandated to safeguard the workers' social and economic well-being, as well as workers' physical safety and health. Next slide, please. In the practice of occupational health, we navigate through the following government agencies, namely the Department of Health, Department of Labor and Employment, Occupational Safety Health Center, the Civil Service Commission, and Department of Trade and Industry. Next slide. In 2017, DOH, DOLE, and the Civil Service Commission crafted a joint administrative order institutionalizing the occupational health and safety system both in the public and private sectors. Next slide. And in 2018, Republic Act 11058, Department Order 198-18 was signed into law by President Duterte, emphasizing on strengthening compliance on occupational safety and health standards and providing penalties for violation. As occupational health physicians, we are mandated by this law that a safe and healthy workforce is an integral aspect of nation building and to ensure a safe and healthy workplace for all working people. Next slide. And with the recent pandemic, the government, specifically DOLE and DTI, issued this interim guide to assist workplaces in the private sector during ECQ and GCQ in developing the minimum health protocols and standards in light of COVID-19 pandemic. And this shall apply to all workplace, employers, and workers. Next slide. In that guideline, it emphasized on the following minimum health standards of the Department of Health, which shall apply across all settings, increasing physical and mental resilience, reducing transmission of COVID-19, minimizing contact rate, and reducing risk of infection from COVID-19. Next slide. PCOM created a technical working group since the start of this pandemic crisis, and one of the issuances is the Return to Work Interim Guide on Health and Safety in the Workplace, wherein it was categorized into 4: prior to going back to work, at the workplace entrance, inside the workplace, and going home. Next slide. For prior to going back to work, dapat dito pa lang, since the start of COVID-19 pandemic, the Health and Safety Committee nag-convene na and started their hazard identification, risk assessment, and determination of controls, or what we call HIRAD-C. There should be close coordination with the Health and Safety Committee, which are composed of OH personnel, the doctors and nurses, safety officers, first aider, members coming from the labor union, from the line managers, and the involvement of the top management, the HR and the employers, because there are some urgent matters that needs their approval. Ang pinaka-importante po dito is the close coordination of the OH personnel and the safety officer, that all control measures are well in place and properly implemented. Next slide. This is our hierarchy of controls. It is used in an organization, workplace, or community to identify the most effective ways to control a hazard. So mapapansin po natin dito, the most effective is on top and the least effective is in the bottom. So when we say engineering controls, requires a physical change to the workplace. So we are talking about the workplace itself. So dito papasok yung mga installation of physical barriers natin, the sneeze guards, HEPA filters, proper ventilation, floor mats and door mats, depending on the type of industry. And also under the engineering controls are elimination and substitution, which are the most effective under engineering controls. Now, for administrative controls, we are talking about the mind and body of the worker. So here, we change the way people work. Dito papasok yung mga protocols natin, mga procedural interventions or modifications in policies, standards, and processes. For example, the social or physical distancing protocols, sanitation, disinfection, and disposal measures, communication, employee training, and isang pinaka-importante is the education on how to properly wear the face mask, the proper hand washing technique, and proper cough etiquette. And lastly is the PPE. So dito sa PPE, it's like we are adding another barrier for the protection of our worker. So if the control measures are properly in place and implemented, the risk of exposure and transmission of COVID-19 will be minimized. Next slide. Prior to going back to work, your occupational health services data is the key in identification of the vulnerable workers. So ano-ano po ba yun? Lumabas na rin ito sa lahat ng guidelines ni DOH, DOLE DTI, and the Interagency Task Force for high-risk pregnancy, 60 years old and above, or any age with comorbidities or pre-existing illnesses like uncontrolled hypertension, diabetes, recurrent asthma attacks, COPD, cancer, blood dyscrasia, chronic liver and kidney diseases, or with immunocompromised status. So here, we make our recommendations whether the employees can be given flexible working hours or allow work from home status, alternative workplace accommodations, on-site or near-site accommodation, and transportation services. Next slide. Now, at the workplace entrance, dito pa lang, dapat yung mga signages natin sa establishments are properly in place na, like the no mask, no entry policy. And of course, the queuing of at least 1 meter radius, front, side, and back, floor markers or chairs in place para mas ma-maximize natin yung proper distancing, the hand washing stations or the alcohol dispensers in strategic locations. Next slide. So dito makikita natin yung picture. Ito yung isang queuing, no? Yung mga worker natin, nag-o-observe sila ng about 1 meter radius. So to minimize the exposure. Next slide. Now, at the workplace entrance, this is the daily symptom questionnaires or the health declaration checklist. And everyone is requested to fill out these forms and advise the workers to bring their own pen. So dito pa lang parang sinasala na natin yung mga worker natin na bumabalik sa trabaho. If there are no symptoms, the worker may enter the workplace and then advise to mandatory use of face masks, the proper hand washing technique, proper cough etiquette, and observing physical or social distancing. Now, if one of the symptoms nag-check si worker or meron siyang temperature na equal to or greater than 37.5 degrees, so the worker will be directed to the isolation area. And what's important here, that all establishment must have an isolation area para doon natin dadalhin yung mga workers natin na maaaring magkaroon ng mga symptoms. If the fever will go down after 5 to 10 minutes by checking with a non-contact thermometer, then the worker may enter the workplace and remind him the mandatory use of face mask. Paulit-ulit po natin nakikita sa TV yan, sa radyo, the proper hand washing technique, the proper cough etiquette, and observing the physical or social distancing. Now, kung yung mga worker naman, yung nag-check sa checklist nila, dinala natin sa isolation area, then the health personnel will come to that isolation area in proper PPE for further assessment. And if indeed na-assess ni OH doctor na this is COVID, so the occupational health physician or the health and safety committee will call the DOH hotline, the MHO, CHO, or BERT, and bring the worker to the nearby COVID facilities if warranted. Next slide. This is the sample checklist which came from DOLE and DTI. So binase din natin dito yung health declaration checklist natin. Next slide. Recently, after the PCOM Technical Working Group crafted the Return to Work Guide for our members per USAL, we presented and collaborated our Return to Work Guide with the different medical societies to have a unified algorithm on return to work. This was presented by PISMID to WHO and the Department of Health and was approved. Next slide. So this is now the unified algorithm on return to work. This was posted by PISMID last May 17, and there are 13,200 downloads for the first 6 hours and about 25,000 downloads after 24 hours. And last May 18, 2020, DOH issues a department circular number 2020-0206, which is the reiteration of the interim guidelines on return to work. So itong unified algorithm, makikita din po natin siya sa DOH website. Next slide. Inside the workplace, we must make sure that the employees know, and we have to constantly remind them on the correct way of doing things. Paulit-ulit, physical distancing of about 1 to 2 meters front, side, and back, hand washing technique, proper etiquette, avoid touching the mouth, eyes, and nose, and alcohol dispensers located in strategic locations. Next slide. Next slide, please. Okay, so ito makikita natin, this is one example of the floor markings. So pag may floor markings doon sa workstation natin, mas ma-observe natin yung proper physical distancing. Next slide. This is an example of unilateral or unidirectional flow of traffic along walkways and pathways. So we can minimize the contact exposure between our employers. And for those establishment na may mga hagdan, as much as possible, if we can have a one-way traffic also for going up and another one-way traffic for going down. Next slide. This is a sample of production area on your left side. You can see the markings also for the proper observance of the physical distancing. And on the right side is an office setup. And we should advise the workers to refrain from sharing of pens and other office supplies and cover keyboards for ease of cleaning, especially for those who share the workstation with their other co-employers. Next slide. This is a sample of the canteen area. So we also have to remind the workers to bring their own eating utensils and avoid sharing of food. So advise din natin na iwan para ma-minimize po natin ang exposure. Next slide. This is an example of a rest area. So as you can see, now observe pa rin natin yung physical distancing natin. Next slide. Okay, for the most commonly touched areas, we should advise to disinfect it. And expert says that we should disinfect it every 2 hours or as needed, like the doorknobs or the handrails, light switches. And kung may elevator establishment natin, advise the workers or the employees to face the elevator wall and follow floor markings for distancing. And clean hands before and after using biometric scanners, photo machines, shredders, ATM. Next slide. While going home, the disposable use of PPE, example, the wearing of the surgical mask, we should advise the worker na dapat itapon siya, ilagay siya sa isang papel, ibalot, or sa isang plastic and then dispose in a closed designated infectious bins. For those using washable masks, dapat naman hugasan natin siya everyday, labhan. And refrain from kissing or hugging any family members. Take a bath first. Discard in separate hamper or use uniform or outfit away from family and immediately soak in water with detergent. And follow physical distancing in vehicles or in any form of transportation. Cell phones. So cell phones is the one of the most frequently touched kahit sinong tao. So we advise everyone to clean your cell phone every time, and if you can put it in a Ziploc plastic for easy cleaning. And yung mga IDs, glasses, keys, lanyard, and pens, pwede rin natin siyang ilagay sa isang plastic. Next slide. This is an infographic that was created by the technical working group. And we disseminated this to all our members last May 21, 2020 about the Worker Health Advisory. Next slide. For the attire, this will be depending on what type of industry. Of course, we should advise everyone to wear shorter sleeves for our hand washing technique. But for some industry like construction and agriculture, naka-long sleeves po ang mga worker natin. For female, advise them not to wear skirts and wear closed, comfortable shoes. Again, depending on the type of industry. Because some manufacturing industries and construction and agriculture, they wear safety shoes. Avoid wearing jewelry and accessories, and avoid stroking hair with hands or tie your long hair. Next slide. This is the return to work criteria for occupational health. So tulad din ng in-explain ni Dr. Arevalo a while ago. For recovered COVID-19 patients with no comorbidities, we can ask them for a medical clearance or medical certificate if hospitalized from their attending physician, whether infectious disease specialist or pulmonologist. And if home quarantined, they have to get a clearance from MHO, CHO, or BERT, and with a RT-PCR with 2 negative results. Next slide. For recovered COVID-19 patients with comorbidities, it's the same medical clearance. If hospitalized from attending physician, from an infectious disease specialist, pulmonologist, and other specialists who manage their respective medical concerns. If home quarantine, clearance from MHO, CHO, or BERT, and with the RT-PCR with 2 negative results. Next slide. For the worker's right to know, every worker has the right to safety and health, and the right to be informed by the employer on all hazards in the workplace, and provide access and training and education on chemical safety and orientation. Next slide. All workers, regardless of employment status, shall be provided with training and information and reorientation on safety and health for workers in high-risk establishment. Next slide. Another worker's right is to have the appropriate PPE that is work-specific to ensure protection, and any failure of the employer to provide such, the worker has the right to refuse unsafe work. Next slide. Some of the duties of the employers is to provide policies and guidelines in the prevention and control of COVID-19, to provide resources for the employees to use, to designate a safety officer to monitor if your engineering and administrative controls are followed and implemented, of course, with the help of the OH personnel. Next slide. Enhance health insurance provision for workers, and the employers may also provide shuttle services, a decent accommodation on near-site location. Employers must enjoin the hiring from local community, and they can put up a COVID-19 hotline and call center for employees, especially for those establishments who have about 500 or more than 1,000 workers. Next slide. Now, this is one of the challenges as an occupational health physician with those workers who have mental health concerns. So we should emphasize every day the actions to stay healthy, such as eating nutritious and well-cooked food, drinking of plenty of fluids, and avoiding alcoholic beverages, adequate sleep of at least 8 hours, and exercise regularly. And we should also advise the employers to provide free medicines and vitamins and provide referral for workers needing counseling or presenting with mental health concerns. Next slide. For the assistance and reporting, DTI and DOLE shall extend assistance and technical support to all workplaces, employers and workers in complying with the guidelines. The employer shall provide the DOLE through its regional office a copy furnished with the Department of Health, a monthly reporting of illness, diseases, and injuries utilizing the DOLE Work Accident Illness Report form, especially with COVID-19. Next slide. PCOM's mission is to work with management and workers as a team to safeguard, promote, maintain, and enhance workers' health, wellness, and safety. And we also take the responsibility of caring for the welfare of the community and conserving the environment for future generations. Next slide. A good workplace practice, mutual respect, and trust will matter more. We ensure the safety and well-being of our workers just as we, as physicians, are bound to our Hippocratic oath to keep the health and well-being of our patients as our foremost concern. Next slide. And that's my last slide. Thank you for your kind attention and thank you for listening.
Thank you so much for that wonderful presentation, Doctor. Before we proceed for the Q&A, I will be requesting for the graph, Dr. EC, so that we would know yung participant natin, kung ilan, ayan, kung ilan, anong mga industry tayo. Okay, so based on the participant tonight, ito po, Dr. Phil, yung mga ating industry na sumali today, no? So 46%, we have retail, hospital, clinic, doctor. Ito, easy yung color. Ano ba to? We also have manufacturing. We have industries like medical, pharma, biotech. Yan, no, we have 6% yung gray. Another one, 6% from government, state and local. 5% coming from the energy, chemical, utilities. The 4%, the green one, others. Ano kaya itong others na ito? There. We have also the darker orange from government, federal, 3%. Darker gray from education. The other parang yellowish, 2%. It's from the support, outsourcing. Darker gray from financial services. So, almost all industries ay kasama dito, no? Anyways, I'm gonna mag-open na po ako. Can we answer questions and answers na po tayo, Dr. Phil? Andito
Yes.
pa po ba si Sir Arevalo kaya?
Ma'am, andito pa po ako, Ma'am Venus.
Ay, maraming salamat po at nagpaunlak po kayo ng oras ninyo. Isa sa mga katanungan po dito, if I may, no, ibalik ko lang po dun sa Certificate of Quarantine Completion po. Para mas malinaw po sa lahat. So, ulitin ko lang po yung sinabi nyo na kapag halimbawa po, pag yung pasyente po ay nasa hospital, of course, yung hospital na po mismo bahala sa certificate. Paano po kung nagpa-clear lang po yung pasyenteng ito sa mga halimbawa, kumpanya? Saan po sila lalapit or pwede na po ba sa company physician po nila ang mag-clearance na lang po sa kanila? Let's say, nag-consult lang to teleconsult na ubusipon. In the usual ano po ng COVID.
As I've said, kung wala din naman pong travel history sa isang area with an ongoing local transmission, wala namang direct contact sa ating mga confirmed positive patients, they have not worked with, traveled with our confirmed patients, hindi naman kasi kailangan magpa-clearance. Yun ang concern natin din sa mga returning employees na baka sila ay hihingan ng ating mga kumpanya
yun nga po.
ng certificates which might not be applicable. Kaya nga ang sinasabi natin when the employees are returning to work, they should also be truthful at sila na rin yung magpupuli sa sarili nila na kung sila ay na-expose sa isang COVID-19 patients, they should have been isolated and contact traced. Doon, pag na-contact tracing sila, they will be monitored, they will be quarantined, pwede sa bahay kung asymptomatic naman sila, or kung symptomatic sila na mild or asymptomatic sila, they can be quarantined in a facility, in a quarantine facility kasi baka hindi pwede yung bahay nila, baka siksikan sila doon, then bibigyan sila ng certificate of quarantine. But basically, kung wala naman itong exposure or travel history within the last 14 days, hindi naman kailangan yung certificate of clearance. Unless they got sick noong mga nakaraang buwan or at least the last 14 days, then kailangan may sertipiko silang ipipresent from their attending physician that I am already physically well and that I am fit to work if they were admitted or if they have consulted. So, ang sinasabi nyo kung nag-consult lang, then probably kung hihingan sila ng certificate ng kumpanya, then pwedeng or maaaring yung pinakonsultahan nila ang magbigay ng certificate. So it might not be a certificate of quarantine kasi hindi naman siya na-quarantine. Might not be a certificate of that he is fit to work, but a certificate saying that they have consulted his clinic as their primary caregiver and that wala naman silang sakit or pwedeng ilagay yung sakit and that they are well and fit to work.
Meron lang po kung question na for both maybe can answer but unahin natin si Dr. Arevalo with regards to the rapid test. Ang gusto ko pong klaruhin kasi meron po akong may mga kumpanya po na nagsasagawa ng sarili nilang rapid testing, no po? Ano po kaya ang masasabi niyo po tungkol doon? Dr. Arevalo muna.
I've said kanina, hindi naman siya mandatory. And ang sinasabi natin, if those companies are opting to have that, then they should, yung kanyang, at the outset, ang cost should be borne by the company and that dapat yung ating tests or rapid diagnostic tests are those tests which are approved and validated by the Food and Drug Administration, as well as the one to conduct the test should be legitimate health workers. Yung ating mga, kung maaari, ita-tie up natin some sort of a memorandum of agreement with a service provider conducting the rapid test. So ito din ay maaaring pwedeng kung malaki yung opisina, baka pwede sila magkaroon ng space for the testing pero we do not recommend such. Mas maganda kung yung ating mga empleyado ay i-refer natin sa isang laboratory or testing center which are licensed by the Department of Health at doon kukunan ng samples. Hindi pwede kung sino lang ang magte-test sa kanila. But yes, dapat ang mag-i-interpret ng ating testing should be our doctors, our accredited or the ones who are licensed to interpret or authority to interpret the test results, lalo na kung RDT yan because the RDTs seem to have false positive results. Kaya nga ang sinasabi natin is that kailangan ito ay i-validate or i-confirm ng RT-PCR pa rin kung mag-positive.
Okay. This one,
Dr. Venus?
Yes, go ahead, Dr.
Yeah,
Venus.
can I give an answer also with that? With
Go
regards to rapid antibody test kit?
Yes,
The
yes, go ahead.
statement of PCOM still stands, and together with the unified statement of 7 medical societies, we are not recommending the rapid antibody test kit as a standalone screening tool for return to work, especially those who are asymptomatic. So si DOH nagbigay na rin ng guidelines, and I concur with Dr. Arevalo na it should be RT-PCR for those symptomatics. No? But one problem for us OH physician is, even though that we are not recommending this use of rapid antibody test kit, what if the employer gusto pa rin nilang i-push through itong rapid antibody test kit? So as an OH physician, we have to follow. But we need to make sure that the Health and Safety Committee nagtrabaho na. Yung hierarchy, ginawa na nila. And the control measures na implement na nila, na ayos na nila. Kasi isang problem natin dyan, there are a lot of our members na nagte-text or tumatawag sa akin, yun logistics-wise. Kung gagawin mo siya sa establishment or sa workplace, saan mo ilalagay yung isolation room mo for the worker, yung pagkuha mo ng blood, and some industries, they are even asking our doctors to be the one to extract blood products. So hindi naman ata dapat yun. And Dr. Arevalo is correct na every establishments, if they are doing the rapid antibody test kit, they should have a memorandum of agreement to a laboratory or diagnostic center or hospitals para yun pag-extract ng blood natin. As an OH physician, yes, we can interpret. And I also agree with Dr. Arevalo na dapat trained po yung kukuha ng rapid test kit. I mean, ng blood products.
Okay. Thank you for answering that. Now, I have a question again, but this time, Dr. Phil, kayo po ang unang sasagot.
Yes.
With regards to the guidelines concerning conduct of pre-employment po and annual medical examination at this time for hiring some companies, paano po ba yon with regards to covering the COVID-19 specific? Meron po bang any advice po?
Well, ang pinaka-importante pa rin dyan is the 14 days rule. Yung 14 days na free of symptoms si worker, and 14 days na wala siyang any travel history with or contact with a confirmed case, no? Nakikita ko rin yung mga questions na yan dun sa isang Viber group with the Philippine healthcare advocates. Up to now, I don't think na may guidelines na when it comes to the annual PE or pre-employment as of now. And nagiging burden sa atin yun as OH doctor. Siyempre, nandyan pa rin yung mandatory na urinalysis mo, CBC mo, chest x-ray mo. And it's abnormal now. Even a simple colds, hindi mo siya kailangan isa walang bahala. So we need to be cautious, no? Of course, for ourselves also, and for the welfare of our workers and their families and their co-workers.
Yes, true enough. Now,
Doc,
this next...
can I have a rejoinder?
Yes, Doc.
Doc, Phil, I strongly agree with you na hindi kailangan siya isama doon sa routine pre-employment laboratories na ginagawa natin, usually yung chest x-ray natin, ECG, EBC, and the urinalysis and stool exam, kasi we may exhaust our laboratory capacity at this point in time. So as we are expanding our the laboratory capacity of the nation, mabuburden pa siya ng mga pre-employment requirement kung i-add natin siya time. Probably in the next, futuristically, if we will be in the new normal na, baka posible, but not at this time that we have very limited laboratory capacity in the country.
I agree with you, sir.
Thank you. Thank you, Dr. Arevalo, for clearing that up. This question, si Dr. Arevalo muna ang sasagot, okay? Are there specific operational guidelines with regard to staffing of isolation areas or rooms? There are companies who are requiring the corporate clinic nurses to man the isolation area for longer periods instead of just being called if needed. So paano po bang ating protocol with regards to the isolation area? Is there another, I mean, dapat ibang staff na lang po ba? Or extension po ba siya ng clinic of the company? Paano po yun, Doc Arevalo?
Yeah, I think yung present kanina ni Doc Phil na engineering and administrative control should only be strictly adhered to. Kasi ang sa akin no, sa guidelines natin, wala tayong minamandato sa ating mga companies to have that isolation room just in case we have employees who are symptomatic, because at the outset meron na tayong policy na yung mga may sakit hindi na dapat papasok. Yung mga papasok dapat ini-screen. And should there be a need for isolation, they should be in an appropriate quarantine facility. Kasi kung mag-isolation pa ang mga company, it might breed infection within the workplace. So agad-agad pag na-screen na siya at siya ay symptomatic, meron siyang travel history, etc., then they are to be isolated. But when we say isolated, sent home with proper instructions for them to be able to be managed accordingly, or admitted to a hospital, or referred to a quarantine facility, or be quarantined at home. Tingin ko hindi na kailangang merong isolation room. Otherwise, kung doon mo na siya nakuha sa workplace, na kunyari pumasok na and then nag-develop ng symptoms while awaiting for the transport for her or him to be referred, then baka meron kang isang holding area, but not necessarily a quarantine area, but a holding area perhaps that has amenities like a hand washing facility, an alcohol rub, and immediately nakamas na kaagad yung symptomatic. Pero ang sinasabi nga ni Doc Phil kanina, no mask, no entry. So I think there's no need for us to burden also the workplace by having to establish a quarantine area, but immediately referring the employee was reported, doon pa lang na alam na merong siyang sakit, hindi na dapat siya pinapapasok, nire-refer na kaagad siya. So also, we need to educate our patients, our workers, that pag may sakit na, tatawag na kaagad sa primary care provider ng inyong kumpanya at wag nang pumasok, so that you will not extend the infection in the workplace.
Okay. Dr. Venus, can I add on that also?
Go ahead.
Yes, I strongly agree also with Dr. Arevalo. Hindi kailangan ng quarantine facility sa loob ng workplace. Nandun sa checklist natin yan, sa return to work guide natin yan. Yes, isolation area for those employers coming in na may symptoms o nag-develop ng symptoms. Kaya nandun din sa checklist natin na the OH physician will assess at dapat hindi tumagal ang worker doon. Call DOH, call MHO, CHO, or BERT, and if it's needed or warranted, dapat yung worker mailagay natin sa isang COVID facilities. Or, pwede natin siyang i-send home for observation, and after 14 days, babalik si employee. Very delikado yung gagawin kung magkakaroon ng quarantine facility sa wala akong nabasang guidelines in any stakeholders or government agency or health agency na kailangan merong quarantine area sa workplace. And I also agree with Dr. Arevalo, even USEC Dr. Tesco Kwek of DOLE BWC, sinabi na rin niya, sa morning pa lang, paggising ng empleyado, masama ng pakiramdam, inuubo na. Tumawag na po sa HR, tumawag na sa clinic, wag nang pumasok. By doing this, we are minimizing the exposure and the transmission of the disease.
Okay. If I may po, ibig sabihin, siyempre ang mga pasyente minsan hindi nila sinasabi ang totoo, di po ba? So, as a medical personnel, pag nakita na po ba namin itong mga simptomas na ito o busipon, we have the right na to refuse that worker to come in the company?
Yes.
Tama po ba?
Yes,
Okay.
kasi ang tinitignan po natin dito is the 14 days rule, no, na asymptomatic walang symptom or symptom-free si worker. Nag-check siya doon ng lagnat, sipon, sore throat.
Sinabi niyang wala, pero nakita po personally na meron pala. Kasi may mga ganun po, nagde-develop yung... Pero
may mga cases na ganyan, pero doon sa checklist natin or sa daily health questionnaire natin, dapat may nakasulat na doon na dapat i-divulge nila lahat ng information. Kasi we have the Bayanihan Act, no? The 11469 and the 11332, which is the mandatory reporting of notifiable disease. So ano sila dyan? Magkakaproblema po sila dyan pag magsisinungaling po sila. We just need to properly educate our worker. So as an OH physician, mag-lecture tayo about COVID pa rin, mag-lecture tayo paano ang hand washing technique, proper cuff technique, kahit paulit-ulit sa lahat ng hallways ng establishment natin, maglagay tayo ng mga infographics doon, yung paulit-ulit na maging muscle memory sa mga empleyado. And there are some cases. For example, I have one company sa Certec. We have about 2,000 employees. So nagiging problema ng mga nurses ko doon, how are they going to review all the 2,000 workers that are coming every day? So ang ginawa namin sa policy namin dyan is pwede namin isend sa email yung health declaration checklist. And they should answer that. Pero kailangan, bago pumasok, bago papasukin ni guard, o bago papasukin ng health and safety committee yung isang employee, dapat yung health declaration checklist na gawa po nila. Kasi importante po yun. Kung hahayaan mong hawakan ni worker yung health declaration checklist, baka mamaya after ng 8 hours work niya or after ng shift niya, hindi pa rin niya nasasagot yun. Magkakaroon ho tayo ng problema doon. Proper education. Ulit-ulitin ho natin ang warning. Nakikita ho nila sa TV yan, naririnig ho nila sa radyo. So, education po is the key for that.
Okay. So, ano po, no? Marami pa ho tayong mga questions dito. However, I know limited lang din ang time natin with Dr. Arevalo and Dr. Phil. Now, if are there any kay Dr. Arevalo muna, no? Last questions ko ito and then I'm gonna ask for parting words, okay? Meron po tayong question dito about if pwede raw po ba yung if an employee presents po ng respiratory symptoms but does not fulfill the definite criteria for exposure as per DOH 2020-0180, yung expanding testing po. Pero dun daw po siya nakatira sa area na talagang high case po ang COVID-19. Should he or she be allowed to return to work once symptoms are fully resolved without the extra 14 days quarantine? Hello po.
Sa Department of Health, pag nasa area ka with high disease burden, kailangan at tapos may symptoms ka, kailangan ka talaga mag-quarantine at i-observe. It can be a home quarantine, a strict home quarantine. You need to see sana kung posible na meron sa bahay sariling kwarto at merong sariling banyo. It can be, they can do the quarantine there and they have to report to the local health authority for the daily monitoring until the 14th day. Or kung hindi pwede sa bahay nila, they can contact their local health authority because meron tayong mga temporary treatment and monitoring facility or the quarantine facility na doon siya pwede mag-quarantine. And then pagka may symptoms ka nasa area ka with high disease burden, pwede kang i-test, no? Lalo na kunyari hindi mo naman wala siyang history of travel anywhere but siya ang namamalengke, siya yung nagbibili ng gamot sa pamilya, then we should have a high index of suspicion. Kasi we don't know, katulad nga ngayon na nag-GCQ na tayo, we should not put down our guard kasi hindi natin alam kung sinong katabi natin na asymptomatic or probably mild na merong infection. Kung tayo ay mag-let down ng guard, probably mai-infect tayo. So the same, kung nasa high disease burden na area ka, may symptom ka, you should have a quarantine 14 days and then mag-notify ka para pag nag-quarantine ka, meron mag-i-issue ng quarantine certificate of completion.
Okay. Dr.
Yes, can I have an answer with that also?
Go
I
ahead.
agree with Dr. Arevalo. Our pre-COVID life will never be the same. Tatagal pa siya until such time we develop a vaccine. And for those areas na with high numbers of confirmed cases, I would suggest, and especially if symptomatic siya, kahit na sabihin mo mukhang hindi siya COVID, pero may ubo siya, may sipon siya, merong maraming cases doon. There are some LGUs na they are testing the person or the family. And 14 days rule pa rin, no symptoms or no contact of travel, no contact with a confirmed case. And we have to protect ourselves. We have to protect our family. We have to protect our workers' family. We have to protect our workers' right. No? So for me, I would still follow the 14 days self-quarantine.
Okay, may mga humabol po, gentlemen, ng mga questions. Okay lang po ba? Ito pa ho, for issue on DPA, our online screening survey of returning employees with regards to declaring their comorbidities prohibited or not allowed? You can answer that. Ano po?
All government agencies, no, like Department of Health, DOLE, DTI, even the Interagency Task Force, they have their guidelines for the vulnerable workforce or vulnerable population. Yung mga workers po natin na may mga pre-existing or comorbidities which are uncontrolled hypertension or diabetes, ito dapat ho yung binibigyan natin ng mga work from home status or working arrangement. Why? Kung ito pong mga workers na to or vulnerable people na to ang tatamaan po ng COVID-19, sila po yun aabot hanggang critical to severe stage. So that's why we are really encouraging our employers, no, the establishments to allow work from home status and alternative workplace accommodation.
Okay. Ito po, meron po akong tanong pang na isa po, no, na galing sa ating participant. If an employee po contracted COVID since work resumed already, will the company be responsible for the expenses or will they shoulder the expense incurred during hospitalization? If mild or home quarantine daw, if their medicines are in need?
May guidelines din dyan, no? May PhilHealth, kung may PhilHealth si worker, kahit papaano wala siyang problema dahil si PhilHealth may guidelines if i-admit natin yung worker. There are some establishments and there are some employers na they are willing to shoulder the expenses. I know one establishments that they are doing that, no? I'm affiliated with them. It depends on the employer, I guess.
Okay. Doc Arevalo, are you still there? May question po ako.
Yes, siguro dagdag ko rin kay Doc Phil yung even the quarantine services, meron na ring package ang PhilHealth. So yun lang, we only have to also inform the company should also be knowledgeable on the benefits of the workers related to COVID. So kahit na quarantine facility or na-quarantine ka, so doon sa accredited, meron ding benefit package ang PhilHealth.
Okay. How about po yung mga doctors po natin na nag-work sa companies as, sa atin na usual kalakaran na retainer physician po. Paano kung sila po ang naka-contract ng COVID-19? Paano po kaya yun? Sino po ang mag-handle po noon? Lalo na yung walang employer-employee relationship, going in and out of many companies, itong mga doctors na to. Covered pa po siya ng PhilHealth din po.
Yes, Doc, that's correct. Kung may PhilHealth siya, covered siya, o better yet, diba, yung iba may PhilHealth na may HMO pang nagko-cover sa kanila. They can always go to the designated COVID hospitals, that of Lung Center, the TALA, the RITM, San Lazaro, or any hospital of choice. Basta COVID-related yan, may benefit package na po yan.
Oh, that's good to hear. Dr. Phil?
I agree with that, with Dr. Arevalo, no? Lalo na sa ating mga OH doctor, kung part-time ka lang, di ba? Hindi tayo regular employee. So iisipin natin ano bang gagawin nila. It's how you talk with the employers, no? Even your status is just a part-time doctor. With this crisis, kailangan talagang magtulungan. Even the employers will need the OH physician dahil sila ang first line ng defense. Sila ang first line. Tayo ang unang or humaharap sa mga pasyente natin. Talk with the employer, discuss this kung sakaling magkaroon ng problem. I know all of us OH physician, yan ang iniisip natin, no? And there are some members who have been calling me also na meron silang duty sa hospital and then their companies hindi sila pinapapasok, no? Pinapa-work from home sila even after 3 months na. So parang nadi-discriminate yung mga doctors natin. So I guess that will be one of the greatest challenge for us OH physician, no? Basta siguraduhin lang natin yung PhilHealth natin na babayaran natin para sigurado ang PhilHealth natin matulungan tayo, no? And I think the most important talaga is the control measures sa workplace. Pagka nandun yun, in place siya, the exposure and the transmission will be minimized.
All right. So another question na po, no? Are there specific engineering standards to follow regarding proper ventilation in the workplace, Dr. Phil?
Actually, sa ventilation natin, ang pinaka-importante dyan at yung famous is the linear ventilation, no? Dapat one-way po siya. Hindi pwedeng ang ventilation mo pagpasok mo sa isang workstation, ang ventilation mo nasa may bandang left side and then may hangin na pumapasok sa likod. That's why may nabasa din ako or isang guidelines ata yun or issue 1 says na sabi nila patayin na lang ang aircon or bukas ang aircon mo pero bukas ang bintana mo. But there are some big industry or establishment na ang ventilation nila is nasa taas eh. Hinihigop niya. Yeah, hinihigop niya yung mga contaminants na that may cause COVID-19. So linear ventilation is the most important for any workstation.
Okay. Dr. Arevalo, do you have comments on that?
Well, usual natin, katulad dito sa opisina namin, maliit, tama po si Dr. Phil na yung malalaking kumpanya na centralized ang aircon, mahirapan. But I think I would really go for the strict adherence to other interventions or engineering controls na hindi lang yung if it's not possible yung ventilation kasi malaki nakasarado yung ating naka-closed ang ating parang closed, confined tayo sa closed workplace, then yung ibang intervention should be strong, like the wearing of masks, the frequent hand washing, alcohol rubs, and the others. So I think kung maliit naman, then tama po yun na buksan na lang yung mga bintana, the blinds, so that the fresh air can come in, and then, you know, hindi talaga mahirap ipatupad kung maliit lang siya. Pero just the same, kung malaki, yun ang challenge. But ang sinasabi natin, long shot, futuristically, dapat nagmo-modify na tayo ng ating workplace. Sabi ni Dr. Phil, there will never be the same time new normal na tayo. Kaya nga sa mga hospitals nga, ang sinasabi na namin na magmo-modify na tayo ng ating mga pathways. There should be two-way pathways for non-COVID, COVID, even yung mga foot baths natin sa mga hospitals na from the infectious to the less infectious. Ang ginagawa natin, kung makikita nyo, sa labas ng ating establishment, doon yung may foot bath, tapos papasok. Pero dapat wag din natin kalilimutan na when we get out, we also have that foot bath. Sa hospital, ang nire-recommend namin from the more infectious area, like inside the hospital, kailangan dumaan ka ng foot bath kasi dadalhin mo sa bahay o sa community yung
With clarifications on that, Dr. Arevalo, so yung mga aerosol na spray, we don't do that, right? Hindi natin nire-recommend doon.
Yes, ma'am. Actually, yung mga, di ba, yung mga may pressure, yung mga disinfectant na may pressure, yung mga yung ni-spray natin sa bahay na mga deodorizer, we do not recommend that. Kaya nga ang disinfection natin, yung hindi siya nagpo-produce ng aerosol. So when disinfecting your gadgets, your surfaces, your frequently touched surfaces like doorknobs, hindi siya aerosolized dapat. Lagay mo siya sa isang container, diluted yung iyong disinfectant, then meron kang basahan, or may basahan kang malinis, then yun ang ipang disinfect mo on the most frequently touched surfaces. So wala pong yung aerosol producing disinfectants kasi parang nadi-displace pa niya kung saan nakadikit yung droplet, baka ma-displace niya.
Alright, yun po, nadi-displace po. With regards, Dr. Phil, any ano po?
Dr. Venus, I would just like to clarify something, no? Kasi meron nag-message sa akin dito eh. Baka na-misquote ako kanina, no?
Okay.
Doon sa slides ko, we need the isolation area, okay? And all establishments should have an isolation area. At hanggat maaari nasa labas siya ng establishment, hindi sa loob. Para na control natin yung mga workers natin na may mga symptoms. Kasi yung sinabi kong hindi pwede ang quarantine area, iba po yun, no? Isolation area is different from quarantine area. We are using the isolation area if there are symptoms from our workers, or halimbawang nagkaroon tayo ng isang worker na sa loob siya ng workplace, nagkaroon ng symptoms, doon po natin siya dadaling sa isolation area. When we say quarantine area kasi, ito na yung mga natin, mga COVID facilities natin.
Yes.
Gusto ko lang i-clarify yun, baka ma-misquote ako ng members natin, no, na about the isolation area. We need the isolation area in all establishment. Yun po.
Yung isolation area, Doc, ang tanong ko rin po kanina is, iba rin po ba dapat ang staffing nun, or sino po yung nasa staff ng medical clinic, yun din po ang mag-i-staff doon sa isolation area? Kasi there are a lot of companies na parang ine-extend nila yung kanilang mga medical personnel from the medical clinic going to the isolation room. Iba rin po ba dapat ang mga tao doon?
Well, that will depends on the health and safety committee, no? Of course, pagpasok pa lang kasi ng worker mo sa entrance, hindi mo naman madalas makikita si nurse doon eh. Ang nandun is the guard, di ba?
Yes.
So si guard ang gumagamit ng non-contact thermometer para malaman yung temperature, and then pag nakita niyang may fever or nakita niya sa health declaration checklist niya, proceed to isolation area. And then the security guard or kung sino man ang nandun, maybe first aider, depende kung anong pinag-usapan ng Health and Safety Committee, they will call the clinic. So the clinic will go there to assess the worker. And hindi kasi dapat magtagal doon eh, no? Let's always think na what if kung halimbawang ito is probable or talagang confirmed case siya. So iniiwasan natin kasi yung contact, no? May mga nabasa tayo, naririnig tayo more than 15 minutes, di ba? Of course, dapat pag pumunta si nurse mo doon or any member of the Health and Safety Committee, dapat naka-proper PPE siya, no? Yung gown niya, naka-mask po siya.
Okay po. Ito po para kay Dr. Arevalo and Dr. Phil din po na question, but I'm gonna connect the two. With regards to the rapid test, di po ba? There are some companies na kumukuha na lang ng mga, let's say, nurses and medtechs to do that rapid test. Now, also, there are general contractor requiring subcon a medical certificate. Is this allowed? Will the health declaration suffice? Paano po yung mga ganun po? Na meron na, di bang nakita ko pong grupo na magpapa-rapid test, kumukuha ng 2 medtechs, 1 nurses, and then getting other doctor to confirm it. Parang ganun po. So, what's your opinion about that, Dr. Arevalo?
Sige. Go ahead, Dr. Arevalo first.
Sinasabi natin hindi siya mandatory. Ang sinasabi din natin na kung magpapa-rapid test, kailangan legit yung ating mga magkakandak ng rapid test. The best option is for the company to have a memorandum of agreement with an accredited testing laboratory for it to be, sure tayo na tama or official yung ating magiging resulta. It is not advisable for just to get from out of the blue health workers sampling our workers, but mas maganda talaga na may ka-memorandum of agreement ang isang kumpanya, isang legitimate laboratory, accredited DOH accredited laboratory.
Okay, Dr. Phil.
Yes, I strongly agree with Dr. Arevalo. No? There's a MOA dapat, and if they do the rapid test kit and nag-positive, kailangan diretso na kaagad ng RT-PCR. And yun sa mga mag-extract ng blood, if I will be asked by the employer, hindi ako papayag. Kailangan trained yun kukuha. We can help interpreting. Why not? And sabi ni Dr. Arevalo, memorandum of agreement for a DOH certified laboratory or any hospitals for them to do the extraction. Kasi ang importante diyan yung waste disposal mo eh. Pag ginawa mo sa establishment yan, paano yung waste mo?
Exactly.
So mas maganda pa rin talaga kung may MOA ka sa isang DOH certified laboratory.
Anyways, Dr. Arevalo from DOH, maraming salamat po at kami ng oras na nagbigay po ng paliwanag sa mga trend ng ating COVID-19, and also Dr. Phil for clarifying all the necessary information about return to work. Dr. Arevalo, any parting words po para po sa ating mga participants?
Maraming salamat po. We commend the Department of Health, commends the Philippine College of Occupational Medicine, Quezon City chapter for hosting the 16th DOH Return to Work. It's been a pleasure to be part of this Kapihang, and we would like really to connect with you frequently for the safety of our workers, and that we wish everyone the best, and lahat po na nandito sa meeting na ito. Sa inyo po, Doc Vino and Dr. Phil, maraming salamat and God bless us all.
God bless po. Dr. Phil?
Yes, thank you, Dr. Arevalo, no? And it's really nice to meet you kahit sa webinar lang. I guess my parting words is, for every OH physician, for every health and safety committee, do your hierarchy. Do your hazard identification, risk assessment, and the determination of controls. And you'll never go wrong. And always remember that if your control measures are properly placed and well implemented, the risk of exposure and the transmission of the disease will minimize. And as occupational health physician, it is our duty together with the health and safety committee to prevent any work-related illness and injuries. Alam naman po natin yan, no? And we act as consultant and advisors to employers when it involves safety and health. And protect yourself. Kailangan protektahan po natin yung sarili natin. And if may ask, no, can I invite everyone, Dr. Venus?
Go ahead, Doctor.
Yeah. I would like to invite everyone, especially our members sa PCOM, on June 10 at 8 a.m. in the morning. If you are available, our National Secretary, Dr. Ria Fajardo, will be having a webinar session with the Western Pacific Region Infection Prevention and Control of COVID-19. This is hosted by WHO Western Pacific region, and I think there are about 30 countries who will participate with this. So we posted it already sa website natin and FB page natin. Let us support Dr. Fajardo for representing PCOM. And thank you for listening. Thank you for having me here. Again, congratulations to QC chapter on your second online edition and 16 Kapihang OH. And I also would like to acknowledge the presence of our national officers here. I think Dr. March is here, our National Vice President, Dr. Ria Fajardo. I see Dr. Balagot is here also, Dr. Marilyn Cruz, no? And andito lang kami. We will kaya natin to, lalabanan natin pare-pareho to, no? And thank you again and congratulations. Dr. AC, thank you very much.
Thank you so much, everyone. Thank you, Dr. Arevalo, once again, and Dr. Phil for having us. In behalf of Philippine College of Occupational Medicine QC chapter, maraming salamat po sa lahat ng participate dito sa ating Zoominar. Sana natutunan niyo po. Marami po kayong natutunan tonight. And sana po, those who want to stay, group picture daw po tayo kung kaya po, no? So we're gonna open all your videos now, no? So meron po tayong digital certificate, no, of attendance na i-accomplish. Those who attended, mabibigyan po through email, no? Sa marami pang tanong, pwede nyo pong i-email sa amin, no? At isa-send po namin sa ating mga speaker para masagot po ang bawat katanungan ng each and everyone. Maraming salamat and have a pleasant evening po. So hello sa ating mga national officers, maraming salamat sa pagsuporta nitong webinar din po, no? Sana marami tayong natutunan. Hello everyone. So, can we have a group photo? Sinong gagawa nito? Maraming salamat, Dr. EC, Dr. Taylor, for all the technicalities. Dr. Jing, na sinuportahan itong webinar as well. Dr. Wendy, our PCOM QC Chapter President.